All right. Yay. Look who I have here. Dr. Judy, we had a conversation a couple months ago, probably now, about the 5 leading causes of cancer. And we said we were going to dive deeper. And today's the day we get to start that. I know you have a busy schedule. I appreciate it. I am Dawn from Colorado Pet Education. I'd like to introduce Judy. We're going to talk about vaccines today, the good, bad, and ugly of vaccines. And Dr. Judy Jasek is right here in Littleton, Colorado. She's an integrative vet that we've actually had a lot of positive feedback and seen a lot of good change through that. And a lot of it's just plain old education and having people understand what and why they're doing something. Don't just do it because for years and years you were told you needed to do it. And so things are changing, everything changes. So if you've got the old mindset that, you have to have these specific groups of vaccinations at these specific times of your dog's lives, we're here to question that a little bit. And Dr. Judy is the perfect person to do that because she's seen it and seen what the trends are. So Dr. Judy, welcome. Take it away. Tell us all you know about vaccines.
Oh gosh. Okay.
We'll be here for days, right?
Yeah. This is a big topic because I feel that I see so much vaccine related disease. And, the reason I'm so passionate about educating people about this and educating people specifically about not over vaccinating is I see so much what I consider vaccine related disease that goes unnoticed. And so, last time we talked about cancer patients, I see so many cancer patients that come in with that initial diagnosis within 6 months of their last round of vaccines. Now, I can't prove that the vaccines had something to do with it, but I've been doing this for over 30 years and you see something enough times. That's pretty convincing to me. And it's not that the vaccines necessarily were the direct cause. I think there's always multiple factors to why cancer shows up. But I think vaccines can definitely be that tipping point because they are disruptive to the immune system. And what do I mean by disruptive? It means that, so I think something that gets overlooked in medicine a lot, in pets, in people with all this COVID business, is that we have an immune system. Dogs have an immune system. Its job is to provide protection. So my approach is to support that natural immunity and let the body do what it needs to do. When we give too many vaccines, the immune system ends up not knowing what's friend or foe, and it just reacts. This is why we see so much itchy skin. How many itchy dogs do you see coming into your spa? Dawn,
tons and tons.
Yeah. And I think a lot of this is this dysregulation of the immune system, and especially in puppies, where we start, well, I don't, but other people, veterinarians, breeders sometimes start so young, 5-6 weeks of age, vaccinating these really young puppies, thinking, okay, we're getting them protected right off the bat. Well, those early vaccines, first of all, oftentimes don't do any good if the puppy is still nursing, because there's antibodies from the mother dog that will actually interfere with the response to the vaccine. And the immune system is still developing. Puppies are not just miniature dogs. Their systems are still developing, and anything we put in their body has the potential of disrupting that normal development. And I think that vaccines are a huge part of this. So when it comes to puppies, there's a few principles that I follow. One is I use monovalent vaccines, which means I only give one component at a time. Most quote unquote puppy vaccines will have 4, 5, or 6 different components. So you have to be very careful. You take your puppy into the vet, ask exactly what they're being given. Don't assume that when they say it's the Parvo shot, your puppy's just getting parvo, because most likely they're getting parvo, distemper, parainfluenza, adenovirus, sometimes lepto. Sometimes they'll throw rabies in there at the same time. And so the puppy is getting all of these different antigens, and then it overwhelms the immune system. So I like to give just one component at a time. So I will give just parvo. I like to wait until puppies are at least 9 weeks of age, because I found if we wait till they're a little bit older, their immune systems are a little more mature. We're a little more likely to be past the time where the maternal antibodies are still hanging around, because the puppies have usually been weaned by that point. And they tend to respond better. So I will do just parvo. I'll wait a week or so, ideally, to give them a break in between. And then we do distemper, and then we titer. And I only do those two components in young puppies. I feel like those are the biggest risk. Other things that they vaccinate against are not as big of a disease risk or are more treatable. I think parvo and distemper are the most life-threatening things that puppies, can be exposed to. Parvo can live in the environment, it can live in the soil, so that creates more of a risk there. I don't find distemper to be common at all here in Colorado where we are, but people move. I want to build a good immunity for the rest of the life of the puppy. And so I do like to protect them for distemper. And then I'll titer 3 to 4 weeks after that second vaccine. We'll do a titer test, and the majority, probably 90% of puppies, will have a good antibody response. And then as far as I'm concerned, we're done. We don't continue to give boosters. And you can continue to monitor that titer level as the dog gets older, just to, if you need to prove it, you're going into boarding kennel or daycare or someplace that wants some proof of the vaccines, and you can ask, will you accept a titer level, which is a level of antibodies against these diseases? And a lot of places will. You just have to ask. You just have to ask. If you say, what do you require? Well, they're going to give you the whole laundry list. But if you say, hey, look, I really don't want to over vaccinate my puppy, I'm working with a holistic vet, will you accept a titer? And sometimes they need to be educated on what exactly a titer is. And I'm happy to do that. I've talked to many owners of facilities and explained why this is valid and why it's important to not over vaccinate. Rabies is different because there are regulations. So if you want to keep your pet quote unquote legal, then you do need to do a rabies shot. I usually recommend waiting until they're 6 months. So again, they're just older. We've got more time in between the rabies and these other, young puppy vaccines. And the immune system's older, it's better able to respond. I prefer not to do things like the Bordetella vaccine, just because it's the Bordetella or the kennel cough it's not that serious of a disease. I mean, most dogs will get it. It's like you or I getting a cough or cold. And if they do get exposed, they're going to build a natural immunity. Now, it's something that a lot of facilities require. So I do have another option. I have no-sodes, and no-sodes are a homeopathic form of vaccine. So this is different. The whole concept of homeopathy is very different than conventional medicine. But basically what a no-sode is, it's an oral form of the vaccine where they take like a nasal discharge from, say, a dog that actually has the Bordetella, but they dilute it out. So in homeopathy, the higher the dilution, the more potent the energetics of the product are. And that sounds backwards. It took me a long time to get my head around how this works. But now I've seen it in practice, and there's actually good evidence from other parts of the world, mostly because no-sodes are not used as extensively in this country, that they can provide protection. So for something like Bordetella, that, it's not as big of a disease risk, and again, I find that most facilities will accept the no-sode option if people go in and ask. And as long as like I can say, yes, I do believe that this is effective, an effective way of preventing the disease. The nice thing about no-sodes too is they can actually work in the face of exposure. So say a kennel or daycare has an outbreak, you could start treating like all the dogs that have been exposed and prevent them from getting sick. Conventional vaccines cannot do that. I do also have no-sodes for Parvo and Distemper for people that want to go that way. Now you don't get a measurable antibody level. So if you're wanting to do minimal vaccines and then have a titer to prove that the puppy has responded and you want that number, you're not going to get that with a no-sode, because a no-sode acts more on an energetic level. But they are very effective. There's a veterinarian back in Indiana, Dr. Todd Cooney, who lectures and writes a lot of articles about no-sodes. And he has not used conventional vaccines in his practice for over 20 years, except for rabies, for the legality part of that. And he's not seeing his patients get sick. And it's also the case that we need to be supporting their immune system. So they need to be on a good diet. If you're feeding, just an average kibble diet and you expect your puppy to be able to fight off these diseases, you're really going to need to improve the nutrition. That's probably the most important thing. And then doing either the minimal vaccine protocol. I like to work with people's comfort levels, right? So some people are I like to give options, right? So I tell people, I don't want to over vaccinate puppies. I feel that there's, way too much risk of that impairing the immune system and causing chronic illness. But people are not comfortable either doing no-sodes or not doing vaccines, then we'll do a minimal vaccine protocol. To me, that's a nice, happy medium. If I were to get another puppy, I would totally do the no-sodes. I wouldn't even do the conventional monovalent vaccines, because I think they can cause, vaccine related illness, and B, I don't think they're necessary when we have an option like no-sodes. But I do feel like it's really important for the pet parent to be comfortable, because if we're going to do a protocol and you're going to take your puppy out, and every time you take your puppy out, you're going to be worried about whether it's going to get sick. And, where can you,
or not take your puppy out, right?
Or not take your puppy out, right?
Because you're worried, or think you're protected and take your puppy everywhere. There's,
right.
It's crazy.
And that's the other thing. It's a great point. Nothing's 100%. Even if you do 6 vaccines on your puppy. And I just had a case I was sharing with you before we started the show, where this puppy came into me. It had 3 vaccines already from the breeder. And we did a titer, and its parvo level was marginal. Distemper level was really, really low. So all those vaccines probably did was beat up that poor puppy's immune system. We didn't even get a decent immunity. So yes, I think there is a false sense of security in doing vaccines. Nothing is 100%. Nothing is 100%, because this is biology, and puppies have different abilities to fight off disease. There's genetics, there's nutrition, there's, all sorts of factors that can enter into that. So for puppies, you still need to be careful. I mean, don't go, to, I usually say grassy areas, like parks, green belts, where there could be lots of dogs that you don't know have been coming and going. Friends and family members, their dogs are healthy, then you go visit them for socialization training classes like you guys offer. I feel like that's one of the safest places, because a good trainer is going to be diligent. They're not going to be letting sick puppies in. And you can see on the floor, I mean, puppy has an accident, it's going to be cleaned up and the floor is going to be disinfected right away. It's not like going out a green belt where like Parvo, will live in the soil. So, you need to be aware there could be things in the soil, or, like we mentioned before, going to the vet. And especially these days of curbside drop off, you're just sending your puppy in where, the sick dogs are. Now, you would hope that the veterinary clinic would be doing its due diligence and making sure that puppies did not get exposed. But in high volume clinics where they have lots of dogs in and out, you just don't know if something could be mixed. So I think you have to really think through what's appropriate, where are appropriate places to take your puppy for socialization, and getting them out within reason also helps build immunity, right? We want them out sniffing around in safe places because that helps build their natural immunity. I mean, I've had people come in and say, well, I was told my puppy couldn't be put on the ground till it was 4 months old. I'm like, seriously? We don't need to put them in a glass bubble. And that's not good either. They need exercise and they need socialization, and they should be out there sniffing around to help build some of that natural immunity. I think another thing to remember too about booster shots and where these recommendations come from, all booster recommendations, including for rabies, they all come from the vaccine manufacturers. So probably a little conflict of interest there. They're in the business of selling vaccines, and they're telling you your dog needs booster shots at these certain intervals. There's no independent research on how often booster shots would actually be necessary. And there's very few veterinarians that actually do titer testing to see, does the puppy or the dog have an adequate immunity, and is there the need for booster shots? Because it's a fact from just a purely immunological standpoint, how the immune system works, that once that immunity is built, it doesn't go away. The cells have memory, and even though certain cells will die off, they'll reproduce, but that memory of that immunity and the ability to make antibodies if the dog is exposed to a disease, that doesn't go away. So there really is no good sound reason for booster shots, except really to make money for the vaccine industry, sadly.
Right. So the titer really gives a picture of the immune system in that way. I mean, so if you had an older dog that came to you say a rescue, and most rescues now, unfortunately, that's where we're seeing a lot of this over vaccination, I feel, because sometimes they're being vaccinated where they were, and then maybe or maybe not those records are transferred depending on who that person is, that middleman is. And sometimes then they're vaccinated again in a very short period of time. And so, we can even see behavior issues with over vaccination. I mean, the health issues are a reason enough, but sometimes we'll see that other kind of behavior stuff. But with older dogs or rescues, so your first thing I would probably guess is going to be a titer test. Let's see where they are and get a starting point.
Right. Exactly. See where they are. I mean, that would be the best thing to do. And, honestly, in adult dogs that have just been vaccinated over and over and over again, chances are they have a good immunity. And if, especially, and if they have any medical concerns, like a lot of the patients I see, are coming in with medical concerns, I'm not going to vaccinate them anyway, because I'm not going to put that on top of their concerns. So again, it's a educational process, and I work with people and what they're comfortable with. And people just like to have that titer done every few years just to see where their pet is at, because then they know they're protected, and they like to have that number. Realistically, an adult dog that's showing symptoms, I'm not going to vaccinate anyway. So, we could forego the titer and focus on other health issues. Rabies, again, gets a little stickier. I still don't do rabies if a pet is sick at all. And Colorado does allow a rabies exemption. A lot of people aren't aware of that. And this is an actual legal form from the state that says that if a pet is sick, then we can forego the rabies vaccine. And a lot of vets won't write them. And I don't know why. If a pet's obviously sick, like a cancer patient or something like that. And it's just this school of thought that vaccines are benign because the vaccine related illness is just not recognized. So I see my cancer patients go back into their, conventional vet, or they have a vet closer to home. They go in for something or other and, update them on lepto or rabies or some vaccines. And it just makes me crazy because we don't need to be boostering these pets, for immunity when they're adults. And we certainly shouldn't be vaccinating sick pets.
Because then we're just overloading their immune system, right? So then they can't fully have, the immune system can't concentrate on the disease at hand. And when you talk about diseases, cancer is a big one. A lot of people might be like, oh, of course, I'd never ever vaccinate my dog if it had cancer, and we were working through that. And I know your philosophy on that is a little different. And we talked about that. You have to look up the last video because it was super good. But with that, I mean, what are some other more minor things? I mean, I have a friend that went in, her little dog was attacked by a raccoon, had an open wound, and they gave it a rabies vaccination because it was due, even though, we know that if the raccoon had rabies, that wouldn't have stopped rabies from manifesting in this dog. But I mean, what are some of the more minor things? I mean, I'll tell people to talk to you if I see a dog that's itching or has hot spots. What about heart conditions? I mean, are we talking pretty much, unless your dog's 100% healthy, shouldn't even consider that and maybe go I mean, I know I would and you would do titer testing 100% of the time. But for somebody that's, maybe this is a new subject for them, what's any unhealthy pet? I mean, disease and unhealthy, two different things.
Yeah, I would say pretty much any symptom, itchy skin that, like we've talked about, chronic ear infection, because so skin issues are gut issues fundamentally. And I think when we are looking at getting the skin and hair coat healthy, we also need to be looking at improving gut health. And the immune system primarily resides in the gut. That's where it gets its foundation. And so if we have itchy skin, then I'm making the assumption that we don't have a healthy gut. Thus, we don't have a healthy immune system. And there's no way we should be vaccinating pretty much any type of inflammation. I would not vaccinate. So anything, whether they're itchy, like I said, ear infections, this chronic GI stuff that, like, my dog acts okay, but never really has a formed stool, or, 2 out of 3, we have, pudding poop or something. We need to be paying attention to that and fixing that before we put vaccines, because any form of inflammation, the vaccines will stand to make it worse because we're dysregulating the immune system.
Yeah. What about something as common as obesity? Overweight dogs, they're everywhere.
Yeah. I think obesity is also a form of inflammation. It truly is. And a lot of those pets are on highly processed, kibble type diets. So they're just getting a whole bunch of processed carbohydrates, and they're not healthy. A dog on a species appropriate fresh food diet, almost all of them, I have seen a couple exceptions, but almost all of them will very easily maintain a nice lean body weight because it's appropriate for their inflammation. And when we transfer dogs from a kibble diet to a raw diet or some sort of fresh food diet, they drop weight. And a lot of that, it's just inflammation. It's inflammation and fluid retention. And we're relieving that inflammation in the body, and also stress. So if I see an obese pet, that pet's metabolism is stressed. They're borderline diabetic because it's just, whether it's a person or a dog or a cat that's obese, they're just right around the corner from a diagnosis of diabetes, because we know their metabolism is dysregulated. And so when the body is stressed in any way, and it's gonna be emotional stress too, so like when I talk to people that are getting new puppies, like if you're going to vaccinate, like give that puppy a little bit of time to get integrated into its new home. It's a big shock for puppies. I mean, what do you think? Puppies cry in their crates. They're not used to being alone. It's really stressful. So you don't want to be piling a bunch of vaccines on top of that transfer. And I see this a lot. Like the breeders will kind of give them a vaccine as they're heading out the door. And then we wonder why these, puppies end up, itching or have diarrhea and those type of things. We have to really look at emotional stress too. Even if there's stress in the household, I think, people don't always realize how much their energy and their stress affects their pet. So if you're going through something stressful yourself, meaning the pet parent or somebody in the home, that's not a time to be vaccinating your pet. Just you can postpone it, you can put it off. And you know what? It's your choice too. And this is something I'm really big on. And Dawn, I know you are too, with your education center, is I want people to be empowered and educated. So when you go into the vet, you know what questions to ask, and you can't just blindly follow recommendations, because they're not always in the best interest of your pet, especially in the corporate clinics. So there's more and more corporate medicine out there, and they are profit driven. And I see the quality of medicine deteriorating dramatically. And I think a lot of that is because of the corporate medicine and the fact that people can't go in with their pets and ask questions. And I hear these stories all the time. Things are done without informed consent, which veterinarians should always be using informed consent, meaning people should be asked, and you should always authorize anything that's done to your pet. They shouldn't be doing anything inside a clinic that they haven't explained to you the pros and cons and given you the choice as to whether or not you should give it. If you're being bullied into doing things, and I hear these stories,
say that. Yep.
People are bullied into treatments, bullied into vaccines. And if your veterinarian is doing that, then you need to find another vet. Yeah. And vaccines should not be required for procedures like surgeries or dentals. The two are completely unrelated. And the last thing you want to be doing if your pet goes in for a procedure that requires sedation or anesthesia, never vaccinate them at the same time. And I see that done all the time.
I was actually going to be, my next scenario was, oh, well, he's going to be under anesthesia. He'll never even feel it. It won't be traumatic. It won't be stressful, but it is. And we have to, you're so spot on. We have to be our pet's advocate. I tell people, don't feel bad about asking questions. Go in knowing kind of maybe both sides, because, there's always, but know what questions you need to ask, and be okay if somebody, we do it all the time. We ask for second opinions in the medical world,
right?
Maybe not as much as we should, but why can't we do that in the pet medical area? And if they don't feel comfortable and they don't want to have the patience to, or they give you a hard time for saying, yeah, let's hold off. You're not saying no, you're just saying, let me look into that. Let me get a second opinion. They should be great with that.
Yeah. And you're paying your veterinarian. They're working for you, So if you think you don't have the right to ask questions, you're going to go, drop $500,000 for testing and procedures, then that veterinarian should be willing to sit down with you and answer every single one of your questions. And if you can't get the vet, and I know it's really hard these days because you don't get to go in, but you should be talking to your veterinarian on the phone. It shouldn't just be all coming through the tech. Not that techs are, not good or can't communicate, but there's always things lost in translation. And if you are going to be, trusting your veterinarian with your pet's care, then you should be able to get them on the phone and directly ask them the questions. Why are they doing what they're doing? And it's not that you're challenging their authority. You just want to know. You're just asking questions. You shouldn't be going through, your pet's medical care with this blind faith. Not that veterinarians are malicious, but you ultimately have the choice to do what's right for your pet. And how are you going to know if you don't ask the questions?
Align. You just have to be in an alignment.
Exactly.
And I think if you are, great. But how do you know if you don't do just a little tad bit of research and see what's going on? We're all about, one of my big mottos is, having our pets live better longer.
Mhm.
And so, I lost my 16-year-old Toby, who you saw,
Mhm.
in November. And, he got to the point where his quality of life, like, it would have meant nothing to me for him to live another year not having a good quality of life. And so I don't care if your pet's 8 or 18, let's have them live better. We want them to live better. And so some of this stuff, we just have to realize that things are changing, ever changing. And if you're still going off of the things you knew when you had a dog, when you were a kid, we just need to really be thinking a little bit differently and exploring that and investigating it.
Right.
That's all.
And so I've been practicing for nearly 35 years. And I look at so many advances in medicine, what we can do surgically, diagnostically, the ultrasounds and the echoes of the heart. That didn't even exist when I started practicing, or wasn't available for pets, especially I was out in some, rural areas. We didn't have those diagnostics. So I see all these advances and pets just keep getting sicker. So what's up there? We have to be asking that question. What do we need to be doing differently? Because with all these advances in medicine, shouldn't they be getting healthier? You would think.
Well, and has the traditional vaccine road changed much in those 30-35 years?
I think there's more vaccines, more different vaccines. And I think there's also a big variable that we don't know all the nuances of how the vaccines are being produced. Are they being produced safely? And there's more toxins in our environment. So I think the pets' bodies are more stressed. They're being exposed to more things. I think the quality of commercial nutrition, especially dry food diets, has gone downhill dramatically. I think it's more toxic and dangerous than ever. So I think you have to be really aware of, that and all these different things that pets are being exposed to. And I think pets are more stressed because people are more stressed. We live higher paced lifestyles. Dogs especially don't often get out and get the type of exercise and the type of enrichment that they really need to be healthy. Dogs aren't meant to just sit home. And a lot of people, well, more people are home now. So it's
Yeah.
changed with COVID, but I used to see clients all the time that their dogs would just be home alone 8 or 10 hours a day. And they wonder why they're destroying the house, because they're social animals and they're not getting exercise. They're not, evening and weekend entertainment.
And I think enrichment, that's a key thing, because exercise, I'll have clients come in saying, but I walk them, 3 miles a day, but that's not necessarily enrichment,
right.
But I
Being
just feel like
walked,
that. What?
yeah. I was just going to say, walking on the end of a leash is not going to be fulfilling for most dogs. And it's hard to find off leash places, but there's things you can do, agility and nose work and things. Like dogs want to use their brain. They want to learn new things,
Problem solve. They want to be problem
Yeah.
solvers. Super
Yeah.
exciting.
They love that kind of stuff.
I just feel like the vaccine world, besides this other area, but the traditional ones are still, like 8, 10, 12 weeks, or 8, 12, 16 weeks. It's just, the 5-in-1, and it just hasn't really advanced the way a lot of other things have advanced on the same scale or pace. But
Right.
that maybe just,
And a lot of that is because veterinarians get their information from the pharmaceutical companies. They're not getting independent education about our vaccines necessary. I mean, they did drop back from going, every year. A lot of them are now every 3 years, because there was a lot of pressure to do that, and no real proof that vaccines had to be given every year. So I think that's changed, but I think it's important that veterinarians learn to think for themselves and not. I remember getting to this point in my career where I felt like I'm just a pawn for the
robot.
pharmaceutical companies.
Yeah.
I'm a vaccine. I heard a word once,
Pusher. You're a pusher.
vaccinarian. Yeah. Like I heard the word vaccinarian. I'm like, yeah, that's not what I'm in this for. And that really started to, change the way I practice. And I got a lot more education on how to do things differently. And is what we're doing really and truly in the best interest of our pets, and not just because it's status quo or because that's what everybody else is doing. Like, really, do you really feel that, giving that the standard of care and the standard of health is giving a pet a bunch of vaccines every year? Like, how can that be? Like, that doesn't even make sense as that a medical professional could even think that way.
Well, I know you got to get to practice. Any lasting, I should have told people to get out their pens and papers at the beginning of this video, because I think it's just such an important topic. And I think we need to be thinking about, again, lifelong of our pets, and how do we keep some of these ailments from developing. And I know cancer is a big one, but so vaccination, any final thoughts, wisdoms? I know it takes a lot more work and a lot more energy to kind of go not against the grain, but not necessarily with the grain and doing what everybody else is doing. And I applaud you on that you can come and educate us on maybe a little different way. And like you said, people get to choose their path. If they want to do vaccinations, they can do that. If they want to do some, the titer testing with minimal vaccinations, or the no-sods. I mean, and that's where that conversation needs to happen, that education needs to happen. And, I like giving people options.
Yeah. And don't believe everything you hear on social media either. Facebook groups, again, a lot of well-intentioned people, but there's a lot of people coming with a variety of, situations and circumstances and backgrounds. And be careful. Be careful about where you get your information. With the internet, there's a lot of information out there. Some of it's good, some of it not so much. So again, just be careful where you're getting your information from.
Absolutely. Well, thank you again, Dr. Judy, and we'll be certainly doing more of these, but I appreciate your time. I know that people that watch are going to maybe just be thinking a little bit differently after watching this video, and that's all we can ask.
Yeah. Well, I hope so. Be an advocate for your pet. I mean, that's the bottom line. Ask the questions and trust your gut. I mean, that's another thing that, I've heard so many people come in and say, I just knew I shouldn't have given that vaccine. I just knew it. I just knew wasn't the right thing for my pet, but the vet just seemed to think it was such a good idea. Just postpone it. You don't even have to say no. Just say, you know what? I just don't feel like this is the right thing for my pet today. And I'm going to put this off. And trust your gut, because you know your pet better than anybody. You're tuned in energetically. So trust those gut instincts. I always listen to what my patients' guardians have to say and what they're noticing and what they're feeling about their pet and what they're picking up on, because I think that's really valuable information. And that's why I allow people to come in with their pets, because I couldn't imagine practicing if I didn't have that feedback from the people that are with my patients around the clock. There's so much valuable information there that I feel like I would miss out on if I did the curbside drop off. So I don't. So if you come to see me, you do get to come in with your pet.
Yeah. And that's super great point. Not only guardian, but, they have that relationship.
Mhm.
And that's why we have pets, is to have that relationship. So, all right. Thank you again so much.
Oh, my pleasure.
Absolutely. Thank you, Dr. Judy. You can reach Judy. Her website is AHA Vet. I always say AHA. So AHAvet.com. I always mess that up. It's Animal Healing Arts right here in Littleton, Colorado. I'm sure she's available if you don't live nearby, that she can even get on the phone with you and do phone consultations, things like that. Super important. Go to her website, get on her newsletter list. Just figure it out. Just do it. Take the time. It takes time. It takes time to do it right. Take the time. You'll be happy about it.
It's worth it. You'll have a healthier pet.
Yay. Thank you.
Of course, my pleasure.
All right. Bye, Judy.
Bye-bye.